the latest breakthroughs. Brought to you by LucidQuest, this update highlights: first, the National Heart Failure Initiative has made remarkable progress. A recent study shows that the Implement HF program increased the use of life-saving quadruple therapy for heart failure patients from just 4.7% to 44.6% at discharge. This initiative also improves social needs assessments and equitable care across 67 sites in 7 U.S. regions, contributing to better patient outcomes and quality of life. In migraine treatment news, a large retrospective study of over 108,000 patients confirms that Erenumab does not increase cardiovascular or cerebrovascular risks. Cardiovascular event rates remained low at 12 and 36 months, even among patients with prior heart disease. Turning to the Asia-Pacific region, a new study highlights rising ischemic heart disease prevalence driven by regional risk factors. Air pollution in East Asia, unhealthy diets in Oceania, and widespread hypertension across these areas underscore the urgent need for targeted, equity-focused interventions. Meanwhile, a Danish study of nearly 27,000 older men found no significant link between short-term PM2.5 pollution spikes and major cardiovascular events, suggesting long-term pollution exposure remains the primary concern. In diagnostic advances, cutting-edge 4D flow MRI technology shows promise in revolutionizing aortic stenosis diagnosis, outperforming traditional ultrasound and allowing for better surgical timing to save lives. A South Korean cohort study of over 1.2 million individuals found that shingles vaccination reduced cardiovascular event risk by 23%, especially benefiting men and those with unhealthy habits 2 to 3 years post-vaccination. For cardiovascular patients, the METS-IR index, a metabolic score tied to insulin resistance, has been linked to dyslipidemia risk across diabetic and non-diabetic groups. This practical tool offers promise for early lipid disorder identification and management. New research on lipoprotein A, or LPA, reveals a continuous rise in cardiovascular risk with higher levels, with no observed plateau. Aggressive LDL cholesterol management may help mitigate this risk, emphasizing the need for LPA testing in clinical practice. A novel mechanism shows that high LPA levels increase tissue factor expression on monocytes, promoting blood clotting in arteries. This immune-mediated process may explain acute heart attacks in these patients, opening avenues for refined risk stratification and therapy development. In cardio-oncology, an AI-enhanced imaging study demonstrates improved detection of heart risks in cancer patients by increasing echocardiography accuracy, enabling earlier identification of cardiotoxicity from cancer treatments. Finally, a breakthrough SIRS AI platform using DNA molecular hooks enhances real-time detection of cardiovascular drugs in blood, reducing interference from biomolecules. This innovation promises more precise, personalized drug dosing and better treatment outcomes. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.